Hi, welcome. This is Health Matters with me, Dishen Kumar. Today's topic is a very interesting one. 1 in 2 adults in Malaysia are either obese or overweight. Now, this is the reality we Malaysians have to face in order to have change. Joining me to talk about this is Dato Dr. Nik Ritza Kosai Nik Mahmud, Associate Professor and Consultant of Gastrointestinal Obesity and Metabolic Surgery, University Kebangsaan Malaysia. Thank you, Dato, for joining us today.
Thank you, Dishen.
All right, let's start off with that statistic. 1 in 2 adults in Malaysia are obese or overweight. How accurate is that?
That's completely true. The National Health Morbidity Survey 2019 shows that Malaysians are very obese. 50% of our population, either male or female, adults, are in either overweight or obese state. But the most worrying thing is 1 in 2 of our population already has abdominal obesity. And that means they have significant visceral fat inside the abdominal cavity, and this is actually the source of metabolic problem, which creates metabolic syndrome, which is a combination of obesity, diabetes, high blood pressure, and cholesterol problem.
Okay, let's, for our patients at home now, being scared and looking at themselves and going, am I part of that statistic? So let's talk about how do you define obesity?
So definition of obesity, there's a lot of definition actually, but the easiest definition will be when you have an excess of fat in your body. Number 2 is the simplest calculation by using BMI. Okay, and there are 2 classification of BMI. Depends which region you live in.
Okay.
The Asian definition of BMI now states that when your BMI is more than 27.5, you are considered obesity. And there are classes of obesity, class 1, 2, 3, and then you become super obese, which is 47.5 in Asian population. If you follow the WHO or the international classification, then it's 30, a BMI of 30 above will be considered as obese.
Okay, why those different classifications based on different regions?
Very good question, actually. It's because Asian is a bit more special. Okay, our gene is...
We Asians are very special.
Absolutely different than our Caucasian counterpart or the rest of the world. Our taste bud is different. Our culture, tradition, around the food and cuisine is also made us very more unique. So hence the reason behind the slight reduction of goalposts of BMI is primarily because Asian then tend to develop metabolic problems or diabetes at a lower BMI group. So the reason by reducing the goalpost of BMI so that we can treat the patient earlier.
I see.
And it's interesting, in my work, we see a lot of metabolic problems, and particularly diabetes in this country, that happens in patients of a BMI between 30 to 40. So interesting. So as compared to the Caucasian counterpart, they start developing more prevalence of diabetes beyond BMI 40. So that's one of the main reasons why we have reduced the BMI to 27.5 as the starting point of definition of obesity.
Okay. Now, Dato, let's talk about an interesting statistic, a quite frightening one actually. 2.8 million people, it's estimated that 2.8 million people die each year as a result of being obese or overweight. Now, 2.8 million people every year, that's quite frightening. What would you say is the status of the current global issue of obesity?
Well, obesity will be here for a long, long time. Okay, and I predict, looking at the rate of obesity incidence, okay, new cases, it's increasing year after year after year, despite modernization of healthcare system. So it's very interesting. There's a paradox there. Okay, so the worry is now the number of children becoming obese is also such a serious matter, because when you talk about children, they are obese as young as 5, 10, 15 years old. So these are children who are going to live on a longer lifespan.
Right.
But with that longer lifespan, and if they're obese, it's going to attract a lot of medical problems. So there are at least known 65 medical problems. These are major medical problems which are attracted to obesity. Plus, the current COVID-19 situation doesn't help the situation, and we know that obesity is one of the important risk factors for COVID-19 complication, primarily because obesity affects our respiratory system. Number 2 is because the risk of developing metabolic syndrome, which is a combination of diabetes, hypertension, and cholesterol problems. So that both combination increase the risk of COVID-19. So if we don't do anything with regards to obesity per se, the risk of number or the rate of number of people dying in the future will increase tremendously.
Okay. Now, Dato, let's talk about what you said earlier about health implications. Those popular diseases that are attracted to people who are obese. Based on your own experience with your patients, what would you say would be the top 6?
Well, the top 6 are number 1, diabetes. Number 2, hypertension. Number 3 is hypercholesterolemia or dyslipidemia.
Okay.
And number 4 is fatty liver. Number 5 is obstructive sleep apnea, where you snore.
Okay.
Okay, and you get daytime somnolence because of reduction of oxygen going in when you sleep at night. You stop breathing practically. And last one is symptoms due to osteoarthritis, because a significant surmountable weight burdening on your joints, particularly the hip, the knees, and the ankle joints. Yeah.
Okay. Now, based on all of that, you said top 6, but a lot of patients come with a combination of those 6 as well, right?
Well, absolutely. It's most have mixed disease when they come to see us. Yeah.
Okay. Now, talking about patients with obesity, how do you think they are managed currently now in Malaysia?
So basically, when we talk about managing patients in any country, we have health provisions to provide service in the primary care, and then you have the secondary care and the super specialist care in the tertiary centre. Okay, so we're talking about clinic kesihatan, we're talking about GPs as the primary health care, and most patient obviously in this country is not aware, number 1, that their obesity has or can potentially result in significant comorbidity in the future. So they only start realizing when their quality of life dropped, or sometimes they felt stigmatized by the population because of their morbid features, obviously. So they do go to the primary health care, and fortunately nowadays, because of we have over the past decade created quite significant awareness, not only to the general public but also to our health professions.
Okay.
They are now aware that there are centers in this country where they provide service for treatment specifically with regards to obesity. So they refer to the center, and the center, not many obviously in this country, more in the very urbanized area.
Correct.
So the likelihood of patient to get a proper obesity treatment relies on the region as well, this country.
Correct.
So most likely they get higher preference to be referred to a specialized obesity unit in an urbanized area, as opposed to rural area. But nevertheless, once they referred to the center, and I'm talking about my experience from our center in University Kebangsaan Malaysia, our hospital in Cheras.
Okay.
We have an established unit since 2011, and it's a multidisciplinary unit which comprises of us bariatric or obesity surgeon. We have endocrinologists, of obesity physicians. We have respiratory physician, cardiologists, ENT doctors dealing with OSAs, physiotherapies. We have very experienced nurses that deal with very, very obese patients. We're talking about average 200 to 300 kilo patients. The heaviest that I have dealt with, 300 and I think about 27 kilos.
Wow.
Unfortunately now, his weight is I think around 108 kilos. So,
What a
but
transformation,
through
yeah.
tremendous effort, you know, others are dietitian, of course. So it's a multidisciplinary management in order to solve one's, you know, massive obesity problem. Yeah.
Okay. All right, Dato, thank you so much. We'll move on into treatment options after this. We'll just go for a short break. So we'll just go for a short break. We will be back after this for treatment options for patients with obesity. This Health Matters with me, Dishen Kumar. Hi, welcome back. This is Health Matters with me, Dishen Kumar. We are talking about an issue that is affecting almost half of our population, obesity. Joining me, Dato, Dr. Nick Ritza Kosai, Nick Mahmud. Doctor, we talked earlier about obesity, health implications. Now let's move on into treatment options for patients with obesity in Malaysia. What are the treatment options available right now?
So first and foremost, no doubt, lifestyle changes. Has to be done. Full stop. So if you don't like exercise before and you like to eat too much carbs and too much fat, then you have to change. Full stop. So without these change, this is the principle and basis of the changes. Then, you know, how are you going to let other people help you?
Yeah.
Okay, so this is very important. But more specifically, result for those who have attempt exercise or diet for, by definition, more than 6 months and has failed, unfortunately, then they can come see us or other specialized obesity treatment center that would focus on more specific obesity treatment. And this include pharmacological treatment. Okay, there are pills form or injectable forms. Then if this still fails, then the next or more, I would say, effective method of making people lose significant amount of weight, but also can resolve comorbidities, in particular diabetes and other metabolic problems, then we're talking about bariatric procedures. Okay, so bariatric procedures, there are several different types. Endoscopic type, for example, putting intragastric balloons. Okay, and obviously the more definitive ones are bariatric surgery. So now it's very important that for the general public to understand that when we talk about surgery, everybody is afraid that they think about, wow, there's going to be a big cut in the tummy. But not nowadays. Nowadays we tend to do it by keyhole operation. Now, of course, first thing is people have to understand why we have to do surgery in the first place. You know, we don't do surgery for fun, but we do surgery primarily to make them lose a lot of weight, to resolve their comorbidities, and ultimately improve their quality of life. And we see again and again significant changes to these patients after they undergo bariatric surgery in cases where surgery are indicated. And we're talking about morbidly obese patients.
Now, I want to put you on the spot here, Dato. Based on your patients that you have, how many of them actually go for bariatric surgery? Is it bariatric surgery a more easier way out, or because surgery is one thing, but then maintaining your lifestyle is like you said, the most important thing? Do a lot of patients go for surgery?
So actually, the number of patients that undergo bariatric surgery is still very, very small.
Okay.
If you consider globally the number of obese population, so say the current global population is 7 billion. So about half of the population is either overweight or obese. So that's about 3.5 billion. So at the moment, on average worldwide, based on the International Federation Society of Obesity Surgery, probably about 500,000 people undergo bariatric surgery. Okay, the number are increasing in the Asian continent because of the increasing number of obesity and diabetes, of course. So the primary aim is not only making people lose weight, but also bariatric surgery can resolve diabetes. I'm not going to go too much into specific, but the reason is by two mechanisms. One is weight-dependent mechanism. So when they lose weight, obviously the amount of fat in the body and insulin resistance state reduces. So that controls their diabetic state. But the most interesting one is the weight-independent effect, because after all this bariatric surgery, the production of incretin hormone, in particular GLP-1, is increased. So it will stimulate the pancreas to produce more insulin. So that's how it reverses the insulin resistance state, and long-term may improve or resolve the diabetes.
Wow, okay. Now, the treatment options, you talked about lifestyle changes, bariatric surgery. There is, how accessible, because you talked earlier, Dato, about where certain centers are in urban areas. What about the people who are obese in non-urban areas, in the kampongs? And how accessible is treatment for them right now in Malaysia?
So, if we're talking about 10, 20 years ago, virtually they're probably not aware at all about that there is a treatment for obesity, okay, beyond lifestyle change, of course. But now, because we have regularly create and become more aggressive in terms of creating awareness among general public, the chances that these patients will ultimately get treatment is much, much better or improved. Okay, but nevertheless, if you look at the regional variation in number of population density, there's still the majority lives in the urban population. So hence, the likelihood that these patients will be taken care more than those who live in the rural population. However, the Ministry of Health, Ministry of Education, in particular in conjunction with the university hospitals, are very active in providing and creating awareness among the overall population, so that ultimately all these patients will have a fair deal in getting the right treatment for obesity.
Okay. Now, what do you think, in your own opinion, Dato, you have all these years of experience on this, do you think Malaysia should have more clinics that can treat obesity, more doctors being able to handle patients with weight loss, weight issues and things like that? Do you think that this is a way to move forward in order that any patient anywhere in Malaysia can actually have specialized treatment for obesity?
I believe that, I think that's the way forward, of course. In the real situation, we would prefer to have more and more centers that can, deliver specific treatment. But obviously, it will cost. So it will cost. A lot of money has been pumped in to create awareness alone. All this treatment is not cheap. Talking about bariatric surgery, which involves a lot of medical equipment that costs a lot of money, and the government actually has subsidized a lot of money to try and reduce the total cost of these treatments. So I believe that if we create a super center, it will be better. But we have satellite small centers or clinic kesihatan, for example, or specific GP with interest with obesity that can actually primarily give advice, or maybe start in terms of medical management to begin with, and they can feed to the super centers if they require further or expedite a higher level treatment like bariatric surgery or other form of more invasive procedures. Yeah.
Okay. All right, Dato. Thank you so much. It was such an interesting conversation. We'll be back right after this. After this, we'll be talking about maybe a bit of a perspective change where we try to look at things from obese patients' perspective, and also what can we do to try to initiate change in society. So we'll be back right after this. This is Health Matters with me, Dishen Kumar. All right, welcome back. This is Health Matters with me, Dishen Kumar. We're talking about obesity. 1 in 2 Malaysians suffer from this. And joining me, Dato, Dr. Ritza, Kosai, Mahmud. Dato, we talked a lot about treatment options, obesity, the whole current situation, global situation of the issue. Let's move on into maybe changing the perspective a bit. Your own experience with obese patients. What actually drove them? What was the main factor behind them being or gaining so much of weight?
So you mean because why they come and seek treatment from us?
Yeah.
So basically, the number one reason is quality of life. So as they put weight over time, their quality of life goes down quite significantly. They can't walk properly. We have young mums who can't even play with their young kids at the playground. And of course, social stigma as well. You know, they take their kids to school and they are stigmatized because of their appearance, unfortunately. So these are the two common reasons why they come and seek treatment with us. Yeah.
Now, do you think there needs to be a mindset change in the society in how they view obesity? And mindset change, I'm not talking about everybody taking obesity more seriously, but trying to manage what we eat, because like you said, it's about the calories you take and how much of calories you burn. So do you see a mindset shift in where people are being more calorie conscious in Malaysia, or people are still like, you know what, I'm just going to go and have my nasi kandar every day and not really bother what happens to my body, things like that?
Well, like I said, the causes of obesity, there's a lot of causes of obesity. The two commonest causes, of course, sedentary lifestyle, and number 2 is eating too much. Okay, but the second commonest would be, they always say it's genetic. Okay, but actually, you know, the chance that you're obese because of purely genetic problem is very, very rare. There's only one case where I dealt with, it's called Prada Wheelie syndrome. It's a genetic problem associated with chromosome 15. From childhood, they eat non-stop. They have slight mental retardation, and they develop diabetes at the age of 15 years old. And they don't last long over time. They tend to pass on less than 30 years old. But
that's a very rare
Very rare. But epigenetic is the issue here. Okay, is the environment now dictate your genes, and it's all about acquisition. Okay, acquisition of something because of the environment. So our population now acquire the likeness of our taste bud to love sweets and fat, because these are the two main ingredients of our food. And this country is such a rich, with such a diverse repertoire of food.
Correct.
Okay, and the base of these foods are carbs and fat, and this is not the best combination. And ultimately, if you eat more and you just continue to have a sedentary lifestyle, we just put more weight. So I think the issue is not only culture issue, which is going to be difficult to change the mindset, because culture will live on with us beyond centuries, unfortunately. And this is precisely, there is a paradoxical, if you look at the graph, that despite modernization of healthcare system, new revolution and evolution of medication and treatment, for obesity, yet the obesity issue is still prevalent worldwide, not just in Malaysia.
Okay, doctor, final question for you. Now, anybody watching right now, if they have friends, family, or colleagues, or even a partner that who is overweight or who is obese, where can they seek help?
So basically, centers that treat with obesity has a specific indication for a patient that can come and be referred to. So they have to be in the morbid obesity group. So that means if you're based on Asian criteria, BMI of 27.5 with significant medical problems, particularly diabetes. Okay, because even at people think it's a low BMI, their diabetes is one important single factor that ultimately will track problem with kidney problems, eye problems, nerve problems. So the aim is to treat this early. Or patient with a BMI 30 above with no significant comorbidities. So these are the ones that can be referred to us. Okay. And it's essential that the primary care, klinik kesihatan is now being informed that any of these patients, they are advisable to refer to us. When I mean us is centers that deal with obesity, and we have several centers in the government side that does that. Okay, one of them is at our place in hospital. University Kebangsaan Malaysia or Hospital Tan Sri Tuanku Mukhlis in Cheras.
In Cheras.
Yes.
Okay, all right. So thank you so much, Dato Dr. Nick Ritza Kosai Nick Mahmud, for a wonderful explanation on obesity. 50% of our population is either obese or overweight. Hopefully that we can see some changes to people taking care of their weight and taking care of what they eat. All right, so Dato, thank you so much. And thank you for watching. This has been Health Matters with me, Dishen Kumar. I'll see you in the next episode. Stay safe, eat healthy, and I will see you next. Bye.